Hi, everyone. Sorry, and thank you so much for being patient with virtual things. Sometimes we do get technical difficulties. So we're so glad that Elizabeth made it on live, and I would just like to introduce her. Um, Elizabeth is our first patient speaker. Um, she is currently retired and living in Kingston, Ontario. She was previously self employed as a bankruptcy counselor. She also provided money management workshops throughout the community, helping people to learn how to budget and get back on their feet again. She was diagnosed with stomach cancer in July 2019 and is currently on a clinical trial at Princess Margaret Hospital in Toronto, Ontario. So, welcome, Elizabeth, and we're so looking forward to hearing your story.
Thank you very much. Sorry about that. Okay, so as she said, my name is Elizabeth Tilley, and I live in Kingston, Ontario. I do have metastatic stomach cancer, and I'm on a clinical trial for immunotherapy at the Princess Margaret Hospital in Toronto, Ontario. I must admit, even though I was a workshop facilitator before I retired, I am quite nervous to be here today. So I guess there's a first for everything. My first step in my journey was, of course, long before the actual diagnosis. Many years before, I was having problems with heartburn, but every time I went to see my family physician and had tests done, including for H. pylori infection, gastritis, etc., the tests kept coming back normal. I received medications to deal with the heartburn issues, like rabaprazole, and it did seem to handle the symptoms at the time, so we went on with our lives. We retired and went cruising on our sailboat. I did have a serious episode while we were away when eating a meal in a restaurant. The pain was so much I couldn't even eat, and it took some time for it to subside. It happened again a couple more times, but on a much milder scale. Upon our return from cruising, I again had tests done immediately, and again they came back normal. Just when I thought everything was okay, I had another endoscopy, and it was then the cancer came to light. I am not sure what I can say very much different about being officially diagnosed, as I think we all feel that initial disbelief, shock, and flood of emotions. However, what I can say is that it's okay to feel what you're feeling. I know that sounds like a cliche, and probably that's the last thing you want to hear, yet it's exactly what you want to do. Feel what you feel, not what you are being told to feel. People mean well, but I found initially I needed to be left alone to absorb the news. Of course, other people's help and has been certainly needed and appreciated since then. I didn't have much time before things got into gear for me. I actually had a rough start because I received a call from the Kingston Cancer Department even before I received that call from the endoscopy doctor with the results of my tests. He had had the best intentions to get the referral in right away. However, he thought then he had enough time to get in touch with me before they did, but he didn't quite make it. So for a few minutes there, I was in a high state of anxiety, to say the least. My actual diagnosis date was July 19th, 2019. After that, a meeting was set up to see my first specialist, who would perform a few more tests to confirm the diagnosis and then decide on the next steps. For me, even these tests presented problems. For instance, the CT scan. I am claustrophobic, and getting things put into my mouth, such as for the endoscopy, was very terrifying for me. That's why I had to become my own advocate right from the start. I had to constantly talk to doctors and many technicians over and over again about my phobia to make sure they knew they had to take extra precautions. Not everyone believes in phobias, so being persistent was important. I can say now that it certainly has paid off, as I now have the best technician in the world at the Toronto General Hospital to do my CT scans. He has worked with me from the beginning to take different steps to make me feel as relaxed as I can to get the job done. From telling jokes to putting me in the scanner head first versus feet, it all has made a tremendous difference. Unfortunately, at the time of my first tests, I had to give up my part-time job because I could not commit to any sort of schedule. I didn't know when the next test was being done until the last minute or how long I would need off. So I made the decision myself to leave my position in order to give myself all the time I needed to deal with my health issues. My employer was great with me and very supportive. I hope that for most people who are working, there would be sick days and a health plan in place to cover time off. I was already retired and had only been working at this place for a couple months, so my situation was quite different. Once all my tests were completed, it was time to meet with the oncologist and find out what was happening. It was confirmed that I had surgery because it had already spread to the abdominal wall or peritoneum. Because of this finding, they told me there was nothing they can do but provide chemotherapy, perhaps extend my time from possibly 6 to 18 months, although they really could not commit themselves to anything concrete. Dr. Booth, the oncologist, proceeded to review the next steps and schedule my treatments. However, at that point, I wasn't even sure I wanted to proceed. It became a decision of quality of life versus quantity of life. It was difficult to decide until my husband asked about the clinical trials and immunotherapy. We figured without surgery, this was probably my only chance for any positive outcome. My husband had read articles and positive results on immunotherapy, so we asked Dr. Booth about it. Although there were no clinical trials at the time going on in Kingston, Dr. Booth checked around and found out about a trial that was being done at the Princess Margaret Hospital in Toronto by one of his colleagues and agreed this was a great opportunity for me. So we asked to be referred, and he did so immediately. Apparently, the requirements of this particular trial were that you could not be receiving any kind of treatment. So Dr. Booth put my treatments in Kingston on hold until we could find out if I could be accepted onto the trial. Dr. Booth remained in touch with me to answer any questions we may have had right up until I was accepted. Unfortunately, a slight misunderstanding occurred when we were contacted about the appointment for Toronto. We understood I had already been accepted, only to find out I had not, and there was quite the process to go through before I would know for sure. I realized at this time how important it was to have another person with you in all your appointments, because you are going through something like this, you don't always think clearly, and you don't always hear clearly either. So having someone with you is good. Also, that I needed to continue to be my own advocate, to ask whatever I needed to, even if it meant repeating things, just so it was very clear to me what was happening. So after meeting with the clinical trial nurse and reviewing the documentation of the trial, there were tests to be completed to see if I actually qualified. Each trial has its own requirements for acceptance. Princess Margaret had to repeat some of the tests that had already been done, including a lot of blood work. And I mention that just because I cannot believe how much blood was taken. It took from September 13th to October 24th to complete everything, and finally hear that I did qualify and I was able to go on to the trial. My treatment actually started on October 24th, 2019. It really wasn't a long time, but as you know, when you are going through something like this, even a day seems like a lifetime. Thankfully, Dr. Alamova, the oncologist in charge of this particular trial, was great in setting us at ease and being so supportive. You may or may not know that treatments are done intravenously. So most people are poked, as I call it, each time they go for treatments. However, if you're going to receive treatments on a long-term plan, then they usually implant a PICC line or a port line. Usually the PICC line is tried first because it can be done quickly. It is placed in your arm and has a line from your arm to the vein, which goes directly to the heart. It's okay, but it's on the outside of your arm, so you cannot shower without wrap completely. It cannot get wet. I don't mind baths, so it was okay for a while, but really not that convenient. Plus, you have to have it flushed every week to make sure it was not getting blocked. This was easy for me as my treatments were every 2 weeks, so I was seeing a nurse regularly to have this done. Eventually, though, it did get blocked after about 5 months, and they had to remove it and put in a port. A port is so much better. It is placed under your skin, still with a direct line to the vein close to the heart, but it is covered by skin, so you're able to shower, swim, do pretty much everything normal. Yes, you still have to monitor it for any blockages, but it only has to be flushed monthly, not weekly, and it is much easier to have a normal life. No one ever sees your port, and you yourself will almost forget it's even there. My treatments are every 2 weeks. The treatment schedule consists of 2 days, one for blood work and any other tests that need to be done, plus per protocol of the trial, I see my oncologist for examination and review, and then the second day is for the actual treatment. My treatment consists of chemotherapy and immunotherapy. The chemo drugs that are a part of my treatment are oxaliplatin, leucovorin, and fluorouracil. The oxaliplatin was discontinued after 6 months because of my neuropathy. My immunotherapy drugs are nivolumab and relatlimab. Quite a mouthful. My treatment is actually extended by 46 hours because they leave a chemo bottle attached to me until a nurse comes to my home to disconnect it. Because of the extended treatment of the bottle, I have to have had it set up with Kingston Southeast Lynn to have a nurse come into my home to disconnect, and also for her to have another visit during the following week to review vitals, etc. I was very grateful they were able to do this because it saved me having to stay in Toronto for those extra days just to have this completed. Finally, everything was set up, and I thought it would all go like clockwork. However, it is just not the treatments I had to deal with. It was the side effects, the medications, the travel, the costs, and the logistics of appointment bookings, which of course involved people. People are not perfect, and nor is technology, so everything did not go like clockwork. This played a big role in my mental health. I was told to try and live my life as normal as I could, to make the best of it, but it became increasingly difficult when the logistical mistakes were made. I'll expand on that in a little minute. First, I am very fortunate and continue to be that my body has accepted the treatments very well. Although at first I experienced the normal side effects of nausea, diarrhea, only for a few days after treatment, but more recently it has become lasting a little bit longer, but overall, still manageable. I do get tired sometimes, and I've had to deal with ongoing neuropathy and a lung infection last fall. But overall, I am very blessed. I have medications to help deal with the side effects, and I was able to set up bi-weekly calls, because of COVID, with a social worker to help me deal with how this was affecting me mentally. I also had an allergic reaction to one of my meds during the treatment at the hospital, but the nurses were on top of that very quickly, and I was given Benadryl and a steroid. Eventually, the decision was made to drop one of the drugs that was causing the neuropathy. Oh, one really good tip I want to give you is that if you're having trouble with dryness or redness in your feet, I highly recommend the Avita Foot Relief. It may cost a bit more than most creams, but I really feel it's the best. I want to also mention that I would not be getting through this without my faith and the support of my husband, family, and friends. Dr. Elamova and her team of doctors at Princess Margaret are wonderful. Although I was fortunate with this team, it is very important to make sure you click with your healthcare professionals, because that can really affect your mental health and in turn, your physical health. Don't worry, not everyone clicks right away, but it's important to talk about these things with your team so you are as comfortable as possible. Having to deal with your health issues is enough. I have to keep a diary for the trial company to keep track of everything that happens on a daily basis in between my treatments, so the nurse and doctors are aware of what's happening and can treat accordingly. The diary also helps me keep track of my good and bad days, so I can plan around them to get out and about and have as normal a life as I can. When I say good and bad days, I mean when I have those side effects, or I'm tired and feeling off. I wouldn't classify myself as depressed overall. However, I do have those days when I feel lonely, that everyone doesn't understand what I'm going through, and I don't feel like getting out, so I spend most of my day lazing on the couch. I think this is normal and that I should let myself feel this way, but you just have to try not to let it last long. Otherwise, I would spend all my day on the couch. COVID certainly has made that an easy task. The financial drain was a lot at first. We had just retired and certainly had not counted on all the extra costs involved with a cancer diagnosis. We live in Kingston, and it is a 3-hour drive to Princess Margaret in Toronto. Who was going to pay for all that gas, parking, hotel stays, food, medications? I was fortunate that the trial covered the cost of not just the trial drugs, but the side effects medications, and also provided a very nominal travel reimbursement. But what about the real travel costs? At first, we stayed with friends as much as possible, which we are so grateful for, at least until COVID hit. After that, we started driving back and forth each day. That's a lot of driving, and getting up in the wee hours to meet appointments was very hard too. We couldn't afford to stay at a hotel all the time, but we didn't know what else to do. I just want to pause here and say to you, just mention that COVID has really affected my treatments. The hospital did not allow any visitors, which meant my husband could not come in with me for appointments or treatments. Being alone is not fun. Also, as you know, things during COVID are not normal. You can't have a normal life no matter how hard you try. You can't get out and about, and you can't see family and friends, which of course is really the most important thing when your life may be short. It really contributed to the state of my mental health, and I look forward to that changing as the COVID situation starts to improve. Right now, I just continue to take one day at a time. So now back to the finances. Luckily, a friend of ours who used to be a community health nurse told us about CPP disability if you were under 65 and terminally ill, something we wish we had been told about when I was first diagnosed. It took a bit of research on our part and quite the process to work with the government and the hospital to get all the information necessary, but we eventually got the application completed and accepted. It was even made retroactive. That was so very much appreciated. Now we have enough to cover the gas and the other mileage costs, meals while traveling, and some hotel stays when necessary due to bad weather or changes. The other part I found hard, and still do at times, is the administration end of things. As you know, dealing with schedules means deal, and that can be very stressful. People make mistakes and have bad days. We all do. However, there's a difference between mistakes and mistakes. I once had a 4-hour delay treatment, only to find it was a simple mistake on the part of the pharmacist, just forgetting to click done after she or he had prepared my drug. Because that wasn't there, the nurses did not know and therefore kept telling me, oh, your drug is still in process. If it hadn't been for me pushing and getting a manager involved, I really don't know how much longer it would have taken. Again, mistakes happen. Be patient. But on the other hand, be your own advocate and don't be afraid to keep on top of things. It's important to know the resources available to you. I am so grateful for this manager, and I'm as well as the patient who I can also reach out to if I need to. So speak up. They're there to help. The hospitals and doctors' intentions really are there to help you. I am fortunate to not only have a great group of doctors, but nurses and healthcare professionals in Kingston to help me believe me, I use all of them. Clinical trials are exactly that. It's a trial. They are trying something to see if it works. They don't know how successful it will be. So with that, my faith, my tenaciousness, my team of healthcare professionals and support people, I have gone from an extremely aggressive cancers of maybe 18 months to live, to having made it through 25 months of treatment and a tumor reduction of 30%. I'm still here. I don't know what the future holds. No one does. I know my cancer is terminal and it could stop working. But this time, I'm just taking one day at a time and thinking positive. So thank you very much.
Elizabeth, thank you so much for sharing your story where, we don't have any questions for you, but there's so many people just saying, thank you, Elizabeth, wonderful presentation. And thank you so much for sharing. 25 months of this is just an inspiration, I think, to so many people here today. I just wanted to echo what you said. Being your own advocate in your care team, I think, is exactly what you need to do sometimes. And you're clearly a fighter here. So your story is truly, truly an inspiration. So thank you very much.